Obesity is a story you rewrite with every healthy choice. Start a new chapter today. Unknown author.
Welcome to Living at Your Finest podcast. I'm your host, Dr. Babs. I'm a triple board certified family, obesity, and lifestyle medicine physician, and I am the founder of Living at Your Finest Wellness, a holistic direct primary care practice. Did you know that 80% of lifestyle related chronic diseases within our communities are preventable, with poor diet being the primary culprit? Now, contrary to what we thought, that it was our unfortunate genes, the good news is that we can make changes together to improve our health and quality of life. So that's what this podcast is all about. The Living at Your Finest podcast is devoted to helping families to live at their finest well-being using a holistic approach with a healthy lifestyle to nourish and flourish as a whole, vibrant, and healthy champion. So join me and my guests as we share transformational and sustainable skill sets from our health and wellness journey to support you and your families in achieving optimal well-being. Ready to live at your finest? Well, let's get to it.
Hello, Living at Your Finest Health Champions. Greetings to you all. Welcome back for another episode of the Living at Your Finest podcast show. Thank you for tuning in. I trust that all is well with you and yours. I am super excited about this episode. And as you can see, when it comes to health and well-being and just, all the things around nutrition, I'm always just filled with excitement. And I'm even more honored that I have a wonderful colleague with me, Dr. Shani Belgrave. She is a bariatric surgeon, and I'm so pleased and honored that she is with us today. She's going to be sharing a lot of goodies. Topic is weight loss surgery, facts versus fiction. We all know there's a lot of that out there, so I'm really pleased that she's here with us. She's going to be talking around just obesity, as a health problem, bariatric surgery. How is it an effective tool? I have a lot of questions to ask her. This is her area of expertise, so I'm really, really honored and thrilled. We're also going to talk about weight loss is a journey. It's not a quick fix, so she's going to share a little bit more about that. But let's start with a brief introduction. So Dr. Shani Belgrave, I love her last name, it's so beautiful. She's a leading bariatric surgeon in Atlanta, board certified and fellowship trained. She's dedicated to helping patients transform their health and reclaim their confidence through weight loss surgery. She's recognized by the Atlanta magazine as a 2026 top doctor, second consecutive years receiving this honor. Whoop, whoop, that's great. She combines not just surgical expertise with compassion, empathy, and highly personalized approach to every patient's journey. So please join me. Warm welcome to Dr. Belgrave to the Living at Your Finest podcast show.
Hi, Dr. Babalola. Thank you so much for inviting me to participate in this wonderful podcast.
The honor is all mine. So let's get to it. I've always been curious. I've seen you, the great work that you do. I see you on social media, and I'm just curious, where did this journey begin? What's the passion behind bariatric surgeon? And just, of course, receiving all the great award, doing good in your community. Can you share a little bit about your background with us?
Sure. So, my training was in general surgery, and then I did an additional specialized year of training in laparoscopic, minimally invasive surgery with a focus on bariatric surgery. And what I really like about bariatric surgery is the transformations that patients have. That's what I love the most about it, the transformations in their health.
And their health, yeah. So my goodness, that must have been a number of years doing all of this, right? So trained, fellowship, but because you have a passion for it, and that's why you went into it. Can you share a little bit with people? Because I know the focus is going to be on facts and friction. But before we get to that, we know that this month of March, is National Nutrition Month, right? So can you just dive in a little bit about what that looks like in your practice? What's that journey like for people that say, you know what, I've done nutrition, but I just need additional help. Can you share a little bit about how you start that conversation with your patients?
Absolutely. So one of the things I love about my work is patients that find me are looking for a solution. They're looking for a change. Many times they have tried, as you said, changing their diet. They've tried exercising, working with the trainer, and oftentimes they'll have some weight loss, but it's either not enough to where they can get to their healthy weight, or they deal with weight regain. And so I always let everyone know that obesity is actually a chronic condition. It is not a matter of willpower. And it's not just a matter of eating less and moving more. Obesity is multifactorial. And so patients who are struggling with obesity, I encourage them to understand that it's not a personal failing, that there are many things that contribute to obesity. Some of those things are behavioral, but there's also genetic as well as environmental components as well.
Yeah, so it looks like it's a comprehensive intake that you go through with your patients, right? And I love that you acknowledge where they are and the progress that they've made, and for them to understand that them coming to you is because they want to achieve optimal health and well-being, and it's not because they just failed in anything that they've done. And I love that about you because, again, in the world and community where we feel like, yeah, let's take care of diabetes, but let's shame patients that have obesity, right? And that's not something that we do. And we educate the community that that's not acceptable either. So for a patient that says, okay, they're listening to you now, and they say, yes, you know what? I think I might be a good candidate. How do you figure out the right candidate for you? I mean, they come to you, yes, but what does that look like? What's the next step in terms of deciding if they're a right candidate? And if they are, what's the next thing that you do in terms of getting them ready?
Yeah. So, what I say is that anyone who acknowledges that their weight is a concern, that their weight is a problem, should have a consultation, because it's really the only way you can get a comprehensive assessment of all what's going on to see if it might be the right fit for you. So obesity, which is the medical term for excess body fat, starts at a body mass index of 30 or greater. And body mass index, or BMI, is a number that's derived from height and weight. And
Mhm.
so for patients who have a BMI of 30 or greater, I think those people could all benefit from a consultation. There's some different things that go into preparing for a bariatric surgery for patients that are using insurance, because many insurance plans do cover bariatric surgery, but we would have to look at your particular plan and what the requirements are. A lot of plans will cover it for body mass index of 40 or greater, even in the absence of obesity related problems. Many will cover it for a body mass index of 35 or greater with some weight related health problems. But I'm starting to see more and more plans covering bariatric surgery, even at BMIs between 30 and 35, depending on what's going on with the patient.
Well, that's good to know because I know that's what we were taught. I'm family medicine, but I'm obesity medicine trained. And I know that we were taught in terms of BMI, just like you beautifully outlined it in terms of what is the indication. There is one for medication begin, but there's also one for bariatric procedures. And you just, from your expertise, you've alluded to it that some of them it varies, right? So having that conversation, not sitting at home and guessing and wondering, is have that consultation and have with the expert that can navigate and figure out if you're a good fit and if it's going to be covered. So it's not just a one size fit all, pretty much is what I'm hearing you say.
Absolutely.
Yeah. So what are some of those myths? I want to get into those myths.
Yes, I
Stuff.
love talking about these myths.
Yeah, because they're out there. They're out there. So please share some of the ones, the most common ones that you've heard, facts versus friction. Would love to hear it from you.
Yeah, so one common myth is that weight loss surgery or bariatric surgery is cheating,
Mm,
that it is taking an easy way out, that it's taking a shortcut.
mm,
And that is completely false. Patients that undergo bariatric surgery, they do a lot of things to lose the weight and to maintain the weight. They make lifestyle changes, and it really is a lifelong commitment.
oh yeah.
And so, just for people not to feel or to allow anyone to make them feel like they've done something shameful, because the truth is that when patients have diabetes and someone puts them on a medication, like you said, no one shames them for that.
Mhm.
But there's unfortunately this stigma and shaming that goes on with obesity, which is one of the reasons why I'm so passionate about doing podcasts such as this podcast, to let
Yeah.
people know that it's a disease and it can be treated.
Yeah, definitely. So I've heard that quite a bit. I mean, I've had patients tell me that, oh, they're saying I'm cheating and, but there's work behind it. It's not, there's
Absolutely.
nothing easy about deciding to do bariatric surgery and procedures. And, I have a dear friend that I met that I would love to connect you with. She had a procedure, I believe. I think it's almost a year and a half ago, and she's doing great stuff within her community, but she lost over 100 pounds and she did the sleeve. And maybe we'll get a chance, you will share with us the different options, the different types. But she's doing so well. She
That's
feels great.
awesome.
But before she decided to do that, she had tried all the different things, gained it back and all of that, but she feels so comfortable in her skin right now. But she said that, before she even had the procedure, it was like almost a 6 months because you had to go to a nutritionist, you had to go to a psychologist, you had to, so there's nothing cheating about it. You're still working, you're still doing the work. So yeah, so that's definitely one. Do you have some others that you want to share in terms of um, frictions and facts?
Yes, yes. Another myth is that weight loss surgery is very risky.
Mm.
And that is completely false. It is just as safe to have weight loss surgery as it is to have your gallbladder taken out. And I would say almost everyone knows someone that has had their gallbladder taken out. And
Oh
it's just
yeah.
the perception, the
Mm.
rates of complications and all of that are very low. And I
Mm.
always tell people that surgery does come with risk.
Mhm.
I would never want to imply that it doesn't, but I always tell patients too that you're looking at risk versus benefit. And being obese comes with a lot of risk of heart disease, risk of stroke,
Mhm.
so many different things, risk of diabetes, sleep apnea.
Oh yeah.
So when you look at the safety profiles of the surgeries, I think that the risk benefit ratio is definitely what makes bariatric surgery an amazing tool.
Yeah, yeah. I love that you said the benefit outweighs the risk. But then when you're listening to all this information out there, be mindful of the complications of having excess fat. What does it do? You have the two arms of obesity, where again, we know it's a chronic disease, is multifactorial. You have the sick mass disease, and you have the added stress, right? The sleep apnea, the GERD, arthritis, and then the metabolic syndrome. So if you're looking at that, you wouldn't make any progress, but yet you're getting more and more complications from all these other aftermaths and complications from obesity. So it's definitely something to think about. Now, I never thought about the way you just said that just as getting your gallbladder removed is just as, I mean, every surgery has risk, but it's similar to that. And every surgery has risks. It's just making sure that you get it done with an expert such as yourself that knows what they're doing, has done a few of them, quite a number of them, and have had great outcomes. Now, there is one myth that I've heard of, and I definitely would like for you to elaborate more on it. People talk about, oh, yeah, that there's a lot of complication that I mean, you're constantly on vitamins or always in the hospital for one complication from the procedure itself. Can you share a little bit more about, I mean, what that looks like if people are concerned and a little bit fearful about the after effect of having bariatric
Yeah.
procedures?
Thank you so much for joining me on this week's episode. My goal on this podcast is to empower, educate, and encourage you to take actionable steps to triumph at living at your finest, body, mind, and spirit. Of note, the information provided here is for educational purposes only and does not substitute as medical advice. Please discuss your healthcare needs with your licensed medical professional. If you are in need of a compassionate and comprehensive holistic physician or know someone who is, please reach out through my website, livewellness.com, for a meet and greet. It will be my honor to talk to you. Are we connected on social media yet? I share more in-depth content on best practices to ensure that you live at your finest daily. So please join me on Facebook, Instagram, YouTube at Living at Your Finest Wellness, where we can learn together and stay connected. Lastly, please subscribe to iTunes if you have not done so already and share the podcast within your circle of influence. An extra step? Leave a review and let me know what topics or discussions you would like to hear more of. Thanks in advance. It is always a thing of joy to hear from you. Now, let's get back to today's episode.
Certainly. So it is true that bariatric surgery patients do have a risk for vitamin deficiencies because they are not going to be absorbing things the same way as someone who has not had their gastrointestinal system altered. And
Mhm.
so there is a need for vitamin supplementation and for having your at least annual labs to make sure that things are stable. There are certain things that bariatric patients can have. One of them is called dumping syndrome. That's a group of symptoms. It can be crampy abdominal pain, nausea, flushing, diarrhea, but oftentimes that can be minimized by doing certain things. One, avoiding things that are very high in sugar after these operations, because with the alterations of your anatomy and the subsequent alterations in hormones, if you eat something high in sugar, you can get dumping. But usually, if you are eating the correct things and separating eating and drinking by 30 minutes as opposed to eating and drinking all at the same time,
Okay.
usually those things are manageable. And what I would say is that, you know, as you've just stated, many patients that have had weight loss surgery, they feel brand new. I mean, because so many of the other things that they had are gone. One of the common things that those patients say is improved energy. Improved
Mm.
energy. And going back to the myths, the other thing that I wanted to say too is sometimes there's this perception that bariatric surgery is cosmetic. And I like to dispel that because having excess body fat is not just a matter of people's
Mm.
personal
Oh,
preferences for
yeah.
aesthetics. The fat
Yeah.
is actually active and it
Mhm.
secretes chemicals that cause inflammation in the body. And that is why people with obesity have increased risk of different health problems, including certain cancers.
Oh, yeah. Yeah. Oh, yes. Well said. Oh, my goodness. Thank you so much for sharing that. It's so important. Cytokines, all the inflammatory markers are secreted. So, yeah. So, very, very important that we understand that this is a tool that
Correct.
will save lives, right? But more importantly, what you said was it's a lifelong. So yes, you have the procedure. That doesn't mean bye, see you in 10 years or don't see you ever. No, I like because I went on your website, I saw that you don't just let them be, you follow up with them. You see how they're doing. You said at least an annual, if anything at all, at least to see because there's some alteration in the abdomen. So you understand that. But if you follow best practices, then you can mitigate those complications, right? And then you'd follow up with your doctor, making sure that, if you're not taking the right supplements, eating properly, not eat, to avoid the dumping syndrome. So I like that you said that. So this definitely should bring a lot of people that are struggling with obesity into really considering having a consultation. And also for healthcare providers and physicians as ourselves to remember that this is available, especially in light of the GLPs, being
Mhm.
available. Tell me something in terms of, I heard this, and I think I might have read it, I'm not sure, but I'm going to ask you because you're the expert. In terms of how much weight loss is achievable with bariatric, does it differ based on the different types? Now, when you compare the different types, what is what is it in comparable to GLPs? Is it about the same? I know that there were some studies, but again, I want to throw it out to you to kind of get your talk on that,
Oh, yeah.
or your
Thank you.
take on
That's a
that.
great question. And so, what I would say is that the two most commonly performed bariatric surgeries are the sleeve gastrectomy and the
Mhm.
gastric bypass. In the case of the sleeve gastrectomy, about 80% of the stomach is removed. In the case of a gastric bypass, we're operating on both the stomach and the intestine. So we section off a part of the stomach to create a pouch so that the
Mhm.
larger part of the stomach is bypassed. Food no longer goes into the larger part of the stomach. So that's why it's called a gastric bypass. But there's also rerouting of the intestines. So the gastric bypass, that's the main difference between the sleeve and the bypass, is the additional malabsorption because of the rerouting of the intestines. So the bypass does have more weight loss than the sleeve gastrectomy.
Okay.
And so when I counsel patients in terms of which operation, which way to go, there's different things that factor in, but one of them can be their starting weight, how much weight they have to lose. With
Okay.
the GLP-1s, which I have adopted into my practice as something in my toolkit to use in the treatment of obesity, with the GLP-1s, Tirzepatide, the two common ones out right now are the Semaglutide and the Tirzepatide. They have
Mhm.
different brand names, but those are
Yeah.
the drug names. And the Tirzepatide has more weight loss than the Semaglutide,
Hmm.
although both work and people are getting
Yes.
results. The both of them still have not met the same degree of weight loss as surgery. The
Okay.
other thing that I tell patients when I'm working with them and we're incorporating GLP-1s is for them to understand that surgery, depending on your situation, surgery is not for everyone, but it is for some people. And I
Hmm.
think it's important for people to know that with the GLP-1s, the weight comes back after stopping the medication.
Hmm.
So it's not really the same as surgery, because if you think about it, if you're taking a blood pressure medication and you come off your blood pressure medication, your pressure is probably going to go back up. So for
Hmm.
someone that's on GLP-1s, which are acting in a few different ways, they're slowing down gastric motility so people feel full longer. It's working in the brain with cravings. It's helping with metabolism. When you pull the medication away, you lose the benefits that you have from taking it. So I just
Hmm.
think that's another thing that really has to be included in the conversation. So as people are trying to navigate what's best for them at this moment, what's best for them over the course of a lifetime, because obesity is chronic, that those
Hmm.
are conversations that should be had.
Right, right. Well, very good. Yes. So I know when the Tirzepatides came out, there was conversation about its merging with bariatric in terms of we know that the newer ones were somewhere between 20% body weight loss, and then the Tirzepatides were hitting like 35, 40. But it's good to hear from you, bariatric surgeon, where it pairs up and in terms of the overall evaluation of which will be a good option. Now, I do have one last question on my end to ask you, and this is tailored around recovery because I do have patients that get concerned. It was like, oh goodness, my lifestyle right now, I don't have anyone who's going to take care of me. I heard that it's going to be months in bed, blood clot risk. Things like that. That's some of the myths and things I've heard. I want to hear from you. What is your take on that? What is recovery like? Do they need a whole like soldier of the army to on their beck and call after just to help with recovery? What does that look like?
Thank you so much, because this gives me a chance to talk about walking, walking, walking. Definitely, patients should not be on bed rest
Mm-hmm.
or, in any state of incapacity for months. That is not the typical recovery.
Mm-hmm.
So, with weight loss surgery, the surgeries are done with small incisions and a camera. And so, people are really encouraged to walk the same day as the surgery, to get up out of bed and to walk. That also helps decrease the risk of blood clots. There
Mm-hmm.
is a risk of blood clots around the time of surgery. However, that's not a permanent risk. It will eventually go back to
Okay.
baseline. So I think that's important to know. But I'm happy to talk about this because, it's so important for people who are considering weight loss surgery to know that just like any major adjustment, you just have to do some planning. So usually I'll tell patients to be out of work for about 2 weeks so that they can
Mm-hmm.
plan accordingly. It's good to have somebody to help you do some things in terms of heavy lifting and things like that. I say no
Mm-hmm.
driving for a week because you're going to have some incisions that might be sore and you want to be able to
Mm-hmm.
slam on the brakes if you needed to. So
Mm-hmm.
usually I tell patients not to drive for at least the first week, no heavy lifting more than 10 to 15 pounds for about 4 weeks.
Okay.
But unless there's some unexpected problem, usually the recovery is about 2 weeks in terms of going back to work, unless you have
Okay.
a heavy lifting requirement for your job.
I see. I see. Okay. Very good. Very
But
good.
Dr. Babalola, the other thing I want to make sure I mention too is that after weight loss surgery, there is a gradual diet progression. So that's something that, we would talk
Okay.
about at the consult. But
Oh,
as you're recovering, we gradually start you off on liquids. And then
yeah.
by the time you get to 4 to 6 weeks, you're on pretty much more of a normal consistency of foods.
Yeah, very good. And just like anything else, right? Just like any other procedure, right? You're not just going to jump into and start eating regular meals. So it's a
Right.
paper. So very good, very good. Yeah, I love it. Very good. Well, thank you. I don't know if you have any other myths to mention, but I think we kind of covered quite a bit. This was great stuff. Thank you for sharing all of this essential information about obesity being a chronic disease, what that process looks like, at least have a consultation, what are the requirements, what is covered, and then what the procedure is usually like and after the procedure. So I think we kind of covered quite a bit. Is
Yeah,
there
thanks so
anything
much for
else
the
you want to say?
opportunity.
Yeah. So let's switch gears though now. We want to hear who you are as a person. We see all the great work you're doing. So I have a few questions just before we, give you an opportunity to share about how we can reach you if people want to get in touch with you. So my first question is, the title of the podcast is Living at Your Finest, right? Living at Your Finest. So what are some things that you do that makes you feel like you're living at your finest well-being?
Yeah, so there's a few things. I enjoy meditation. Every day I have to have at least a few minutes um, of quiet.
Nice.
So that's something that I do daily. When I can, one of my favorite places to go is the beach, mostly just to listen to the waves.
Yeah.
And I find that to be very relaxing and very peaceful. So that's one of my favorite things to do when I can.
Nice. I like it. I like it. All right, let's go to question number two. What is your favorite? Let's see. I was gonna ask a movie. Okay. Decide movie, music, or show. You decide which of the one and why. So what it is and why. I'm curious what the bariatric surgeon watches or listens to.
You know what? It's so funny. I don't really watch a lot of TV. I don't really watch a lot of shows.
Okay.
But movies I do enjoy. My favorite actor is Denzel Washington.
That's
Reese.
mine too. That's my movie husband. Yeah, don't tell my husband, but yeah, I
I
think
just
my
think he's
kids know already.
yeah, I think he's such a great actor. So he's one of my favorites. Also Viola Davis. So for a movie, I have a few, but I would probably say The Five Heartbeats. Even
Okay.
though that's not a Denzel movie, I just think that's a classic.
All right, very good. All right, tell us one word that describes you.
One word. Oh, I got it. Energetic.
Energetic. Nice. Love it. Very good. Well, thank you so much. This has been great. I want to give you an opportunity. Please share how we can stay in touch with you. By the way, Dr. Belgrave has a lovely podcast. You guys need to follow her. I bet she's going to share more about it. But please share with the audience how we can stay in touch with you if you have any new projects and any last parting words.
Awesome. Well, thank you so much, Dr. Babalola. So my practice is Oneka Bariatrics and Wellness. We are located right here in Sandy Springs, Georgia. You can check out our website. It's www.oneka bariatrics, bariatrics.com. I still have my Dr. Shani Belgrave page online. Those two are connected. And of course, you can follow me on Instagram, Dr. Shani Belgrave. And as you mentioned, I also do a health and wellness program where we discuss all things health, wellness, and inspiration. And that's on YouTube. It's the Coalition Talk Show with Dr. Shani Belgrave.
Awesome, very good. We definitely will check you out because you just have a lot of great materials and great resources for the community. So thank you so much once again for joining us. For our listeners, definitely would include all the show notes, the links so that you can get in touch with Dr. Belgrave. But again, as you've all heard, have this conversation. Don't keep quiet. Don't sit on it. There's no such thing as failing to take good care of your health. There are multiple tools, whether you decide that you want to do a GLP or you want to do a bariatric surgery, sorry, whatever that is. Okay. Yeah, whatever the procedure, just have a conversation. Know that you deserve to live at your finest well-being because you are worth it. There are expertise in the house. There are people that can help you. If it's that you need to talk to your doctor to make that referral, just please don't sit on it. There's so much wealth of knowledge and health that you are missing if you just sit on it. And every year, if you just keep gaining weight, it's just going to keep increasing the complication. But just having that consultation, they say when you know better, you do better, right? So that's the goal. So thank you all so much for just listening in, and we hope that you return for another episode. This is an episode to share, so make sure you share it with your friends and your neighbors, because healthier together is the way to go. All right, until next time, take care. Stay blessed. Bye.
Bye.